talking about varicose veins and how they can be treated with the emphasis on non-surgically. A major source of pain and disability in the United States can really be managed, and it can be managed local to us without much of a big deal, right?
Yeah, right.
And you're at Rex Hospital in Raleigh. I mean, that's what I looked up, and I found that all you have to do is just go straight into Raleigh, go on 440, get off on Lake Boone Trail, and
Right.
you are right there.
Yeah, we're right across from Rex Hospital, and that's probably our Raleigh office is probably the closest to most of your patients.
I would think it would be.
There.
Right, and it's an easy transportation, and once you see what we're talking about, and you'll find that it's well worth the trip if you have leg pain because of vein disease, because you just don't have to live with pain. So. Tell us, we ended the first segment with you telling us about how, beginning to tell us about how varicose veins are treated.
So as we alluded to earlier, the treatment of varicose veins in the past have not been, let's say, kind. It's been brutal per se.
Right.
And actually, even the funniest thing, then way back in ancient times, they used to beat on your varicose vein. So,
That'd make it worse.
So when they beat on the varicose vein, it causes a clot, and the vein goes away.
Right.
We stopped doing that, but then we move to stripping.
That's the old Bible and ganglion substitute.
Right.
Yeah.
So stripping is what, even when I first started, stripping and foam injection were only two options. Obviously, foam injection was much better, and we can talk about that too. But as far
is that done anymore?
Oh, that is definitely actually one of the best ways to treat varicose vein.
And the company that developed it came to watch you do it, right, because you and your partner are so good at it?
Right. So I started doing foam injection way back when it started.
What is the foam?
The foam is polydocanol or sodium tetradecyl sulfate. It's a detergent. There's only two medicine approved by the FDA for treatment varicose vein. So the reason is we started using it as a liquid. So the liquid works. It just doesn't work as well.
How does it work?
Basically, it's a detergent. So basically, your vein walls have a fatty lining in it. So when you inject the medicine, it dissolves that fatty lining.
Right. So don't inject your veins with Tide. Right.
So initially it worked very well as a liquid, but when you inject a liquid, you can't see where you're injecting. You can't see the medicine flow.
So the foam would show up on an X-ray or an ultrasound.
Right,
machine.
and I'll show you some pictures of that.
So we have some. Yeah, you brought some videos with you. Okay, great.
And also, foam displaces the blood, so pushes the blood out of the way, so that
there's greater contact with the agent,
exactly.
the medicine.
So there's
against
more
the
surface area in the foam, so that makes the medicine work extremely better.